For a population of about 13.2 million, we are talking of almost 1.2 million people between the ages of 15 to 49 living with HIV. HIV has touched most of us in a very particular way. In the early 90s, we lost almost 3 or 4, maybe 5 key members of the family. My father being the only person who was surviving in that family. A lot of orphans came to live with us. I mean, that had a lot of impact on the family. And that, for me, has always been a motivation to try and see how we can work to reverse the impact that HIV has had in the Zambian community.
The country made a very bold decision to provide ARVs free of charge in public hospitals.
We have ensured that ART is not only provided in hospitals, we can go all the way up to a rural health center. That has improved access and has enabled us to increase the numbers of patients. It's quite a big program, which has grown from its inception in 2002 with just under 200 patients, who have grown now to slightly below 600,000 patients.
I was tested and the results came out positive. I was very scared, but looking at the information that I was given and the testimonies that I got from the people who were already in that situation, the fear just went away because I knew that there was help. I've actually found help. I've actually been on treatment for about 8 years now, and I can actually live longer and do the things that I want to do in life.
Even health-wise, I've been okay. No sickness since I started my treatment here. So it's been benefiting for my family because I'm doing everything for them.
Very few people will actually stigmatize against themselves or against the other person, because now they know that there are interventions there that can help them out.
We are receiving overwhelming response from the community. They know that there is hope. When they are tested positive, it's not the end of life. It's just the beginning of another kind of life.
But now I can't even become sick. I'm happy, I'm fit. I can do work, I can do farming.
The story of the number of people that are on ARV drugs in Zambia is incredible. The number is over 500,000. And I know that that just sounds like a number of people taking medication, but that really results in people that are able to go to work, that are able to take care of their families, that are able to raise HIV-free households. And so I think that just the almost indirect benefits that we don't always think about are just massive.
We are currently rolling out the prefab clinics, which have been procured with the support of Global Fund, to ensure that all over the country where infrastructure is lacking, we have put out these clinics. At the moment, we're talking about 39 clinics that are being rolled out throughout the country. If you look at the achievements that the ART program has made, there are a number of factors that are responsible for that. Without the products, we would not be able to have so many people on treatment. So Zambia has got quite a robust system for ensuring commodity security, which is well supported by the Global Fund and by other partners, and the government has continuously increased a stake. The ministry is fully aware that this program needs to be run in a sustainable manner.
So that starts, setting questions about sustainability and the need for government to put more resources in treatment. And you start asking yourself, are we ready for this?
I still see a very big role that our partners have to continue playing in the future to ensure that our people who are on lifelong treatment are assured that they will have this treatment come next 10, 20, 30 years.
And am I coming again?
And I think that that's where donors should not be complacent and say, look, we've sorted out this problem, let's pack our bags and go home. There's a lot of work to be done.
We have these drugs that help us to be strong again. And if we're stronger, which means we'll be able to work and fend for our families, there will be nothing like holding us back health-wise.